Welcome to The Explainer. Today, we've got a real medical detective story for you. We're going to look at how years of just crippling pain can come from an injury that our best, most powerful diagnostic tools, I'm talking about MRIs, can't even see.
So just imagine this for a second. You are in constant pain. It's totally messing with your life. But when the doctors run all the tests, the scans come back clean. For way more people than you'd think, this isn't some made-up scenario. It's a super frustrating reality. And for a lot of them, it all starts with this mysterious pain in the hip. Okay, so let's dive right into this mystery. We're talking about this persistent, just awful pain on the side of the hip. The kind that can leave even the most experienced doctors scratching their heads. A pain that just will not go away, no matter what you throw at it. So to really get this, let's talk about a real person. We've got a 34-year-old elite triathlete, right? And for 9 long months, she's dealing with this hip pain that just explodes every single time she tries to run. And look, we're not talking about a minor ache here. This is the kind of thing that stops a high-performance athlete dead in their tracks. And none of the usual treatments were working. And this is where the plot really thickens. The doctors look at her MRI, and it looks completely normal. A trained radiologist looks at it and says, yep, nothing to see here. But that doesn't change a thing for the patient, who's still in debilitating pain. So what in the world is going on if the MRI can't even see it?
This really brings us to a huge question, right? Why do our best, most trusted imaging tools, the MRI is the gold standard for a lot of things, why do they sometimes just fail? Why can't they find the problem? Well, the answer is all about learning to look a little closer.
So check this out. Here's another case. A patient has persistent pain after a car accident. And, you guessed it, their MRI looked totally fine. What we're learning is that standard MRIs can actually miss really subtle damage, specifically right where the tendons attach to the bone. It's kind of like trying to spot one single frayed thread on a giant rope from super far away. The MRI just isn't designed to get that granular. You know, when a patient comes in with pain on the side of their hip, doctors have a whole checklist of usual suspects: tendon problems, tears, that kind of thing. But what this research shows is there's this hidden culprit that almost always gets missed. It's a condition that affects the iliac crest. That's that top bony part of your hip. Yeah, you can feel it with your hands right now. So the big question is, if the multi-million-dollar MRI machine can't see it, how do you solve the mystery? Well, the answer, as it turns out, doesn't come from powerful magnets. It comes from sound. We're talking about a different kind of technology, musculoskeletal ultrasound. It's literally learning to see with sound waves. Yeah, so unlike an MRI, which gives you this one static picture like a photograph, ultrasound is like a live-action movie. It uses these high-frequency sound waves to give doctors a real-time moving picture of what your muscles, tendons, and ligaments are doing right now. And this is the absolute game changer. A skilled expert can take that ultrasound probe and press right on the exact spot where you say, ow, it hurts right there. And at the same time, they can see the tissue underneath in super high resolution. It connects what you're feeling with what the doctor is seeing, live. That ability to see and touch at the same time is how they find problems that every other scan just completely misses. So, by using this amazing tool, specialists in a recent study were finally able to put a name to this pain. They figured it out. They identified the true culprit behind these mystery hip pain cases that had been stumping everybody.
And the diagnosis? It's called iliac crest enthesopathy. Okay, big words, but basically it's a disease right at that attachment point, right where the tendon meets the top of the hip bone. And instead of being healthy and strong, the tissue gets all thick, jumbled up, and even torn.
Okay, so let's actually look at the evidence. This is what it's supposed to look like. Under an ultrasound, a healthy tendon attachment, see how it has that nice, clear, compact pattern? The fibers are all lined up, tightly packed, and super organized. Think of a brand new, perfectly made rope. It's strong and it's ready to work.
But now look at this. This is from a patient with the condition, and you can see the tissue is just a mess. It's swollen up to almost twice its normal size, the fibers are all over the place, totally disorganized, and you can even see little tears in there. This picture just screams pain. It perfectly explains why these people were suffering so much. But the story gets even crazier. The power of this ultrasound technique led to an even more incredible discovery. For one patient, the scan didn't just find the source of her hip pain, it showed something way, way more serious. The bone itself was being eaten away. It was a huge, critical warning sign that every single MRI before it had missed. This triggered an urgent biopsy, which led to a life-saving diagnosis of cancer that had spread. I mean, talk about a shocking twist.
Wow. Okay, so diagnosing the problem is one thing. That's half the battle. But what about fixing it? Well, it turns out this super precise diagnostic tool also paved the way for a brand new, minimally invasive way to fix it.
So instead of a big open surgery with a long recovery, they do this whole procedure through a tiny little incision. We're talking less than half an inch long. They use that live ultrasound image to guide a tiny little shaver right to the damaged spot and just carefully remove only the bad tissue. The precision here is just incredible. The surgeon is literally watching a live video feed from the ultrasound, guiding this tiny tool to scrape away only the damaged, messed up parts of the tendon. All the healthy tissue right next to it, it's left completely untouched. And the results? They're really dramatic. You look at a follow-up scan just 3 months later, and where you used to see all that damaged, painful tissue, now you see healed, healthy, functional tissue. The body has fixed itself. And for the patient, that means one thing: the end of all that chronic pain.
And look, the most important thing here isn't just the cool technology or the images on the screen. It's about real people getting their lives back. Remember that elite triathlete we started with? Well, after this procedure, she didn't just get back to competitive running. She went on to win her age division in a triathlon only 8 months later. Just incredible.
So this whole story just leaves you with this one big, fascinating question, doesn't it? How many other mystery pains, these chronic, supposedly unsolvable problems, are just sitting there waiting for the right pair of eyes or the right technology to finally see them?